Okay, let's look at this. Let's look at this chart, and I think we'll do two things with this depression chart that's on the screen. In an earlier thing, I said the depression is like a bell. This chart is a little bit more accurate. Well, it's kind of hard to do because it's got peaks, sharp points, but it should also have some smooth drops and smooth rises and some sharp drops and some sharp rises, because depression it's changing all the time. Vertical axis on this chart represents kind of degrees of happiness. What do I have down there? Functionality and happiness. Functionality is actually very good. Both of those are good. It represents two things. And the horizontal axis is a representation of time, and you'll notice that towards the top there is a dotted line, which sort of, all this stuff is, this isn't numbers, this is just to get across an idea. It's not trig. We're doing it with this chart. The dotted line represents a normal life. And so at the first of all, I've started in a normal life before we hit the depression parts. There are days when you are just really happy, happier than normal. And we have those moments in life, and they're wonderful. They don't happen a lot, but they do happen. Okay, so on this chart, you'll notice that there's a thing called a tipping point, and there are two things marked trigger points. And the trigger points, one of them is going down, if you'll notice, and the other one was up and then going down. And both of them are on, one of them is on the descending side of the chart, and the other one's on the ascending side of the chart. And those points, the tipping point first is, and that, who knows, maybe that should be right on the line of normal. But the tipping point is when you become aware that there's something wrong, that you're not getting back to happy, you're not getting back to normal anymore. That's what that represents. I mean, you've had a happy day, and then there just hasn't been a day when you've gotten above the normal and had those feelings of happiness. And it can be caused by death, it can be caused by economic stress, not your own death, but death of a loved one, or a loss, some other kind of loss, even a pet. I mean, it can be caused by a lot of things. The problem with depression is that it is a kind of chemical trigger. I mean, it's not, there's chemistry going on here too. And so that's why I say, as soon as you start to get depressed, you really need to see a professional doctor and get some chemicals, other chemicals, in your brain, antidepressants. You need to try them, and I've explained that in an earlier video. Because part of this process is chemical, but that's not what we're concerned about on this blog. We're concerned, get on pills, absolutely. But and you might have to change drugs because sometimes they don't work very well. I had to try, I think, 4 or 5 different antidepressants the first time I got on one to find one that helped. But what we're talking about is the emotional and the mental, the functionality and happiness part. That's really good. I wrote that chart, and it's a good. That's a good way to say it. Functionality and happiness. So you will notice. I think first when you're depressed that it's the normal part that's dropping off rather than functionality. I think that comes a little bit later. At least it did for me. What I notice is that I just don't feel normal. I just can't get up. I can't raise my own spirits. There's nothing that I'm able to do to lift myself. And this is why it's extremely dangerous when this starts happening, that you don't self-medicate, that you don't say, well, let's go out to the bar with the boys and have a few beers and fix that problem, because that actually may have worked in the past. But when you get that chemical tip in your brain, and the brain chemistry goes wrong, putting alcohol there in that mix is the wrong thing to do, and I've talked about that as well. So this is a sort of a life as we move through time here. I'm sort of giving you tips on what to watch out for as well. So when you notice that tipping point, that there is, well, how should I say this? In some cases, there's a quick fix for depression. Not everyone that gets depressed, goes to the bottom and becomes catatonic, and some of the things that have happened to me and to people that have real problems with depression. I mean, depression can be a week. Maybe your pet does die, and it upsets you for a week, and that's a normal reaction. And so I can't even say that going to the bar to get a drink with the boys might help that one. But and I was going to say, but don't risk it. You'll know whether or not to risk it. I mean, because you should be aware enough to know the ups and downs that you've had in your life, to know which kind of, at least to have some sort of median, some knowledge of what kind of a hit you can take emotionally and come back from. Now, I don't know the emotional hit that I will take when one of my parents dies, because I haven't lost one, thank God, yet. So I don't know that, but I do know the emotional hit of having a favorite pet die. And that's a tough hit for me, but it's something that I can put away fairly easily. My problem, of course, is the chronic pain is introduced in the depression mix. So anyway, you have some sense, you should have some sense, and if you don't, now's the time to start thinking about these things. So that's what Life and Reason is about. You should think about where is it in your life that you've been hit with an emotional disturbance, and it was hard to pull yourself back up. And if you're depressed, remember, when I talk about depression, every time I talk about this, if someone is severely depressed, I'm not talking to that person. I'm talking to their loved ones. And that because a severely depressed person is unable to interact and think through and follow these kinds of thought processes. It just doesn't happen. It can't happen. I've been there before if you're too depressed. So and that's, I get interrupted in my train of thought sometimes because I think, well, I can't help them if I say that, but I can help someone who loves them by saying that. So, if you have a loved one that has come back from things, but this time they're not bouncing back up, they should know it, but you might have to tell them. I mean, you might be able to intervene at that point and say, hey, there's something not quite right here. So that's either the depressed person or a loved one can focus on that tipping point and notice and try to bring the person to it. I suggest that everyone that watches this be very introspective about that and sort of go back and set a standard for what things really hit you hard emotionally, and it's tough to get back up, and what sort of emotional hits you can take. And it hurts, of course it hurts, it's life, but then you can rise above them. And that's just something you need in your philosophy book of life that we're sort of trying to write together here, is a kind of awareness of what that level is for you. And of course it's a moving target, but that still, if you think about it, then you've got it as a tool. Okay, so you reach the tipping point, the drugs come in, and I think for most people, functionality will, because a lot of us function on automatic. We have jobs that we can keep doing even if we don't feel well. My wife is the most amazing person. I've seen her work with incredible migraine headaches, and I do not know how she has the willpower to get through in those situations. But that's not depression, that's just her amazing. So functionality is actually, I think, hurts worse. Well, it does for me. Now, this will be different for different people too. So you can't get back to happy is one of the things you have to watch for, and if that goes on for very long, either the person that loves you is helping you recognize that, or if you recognize it yourself, if that keeps going on, you need to have an intervention, a medical intervention, sooner rather than later. So figure out what the sort of standard hit is that you can take, and what would be a dangerous hit for you. For me, for example, I know that if one of my kids died, that it would be an extremely dangerous situation for me, and I know that as a rational thought, and because I know that, I can prepare myself for that. And I'm just giving you a radical example. There are some hits in life that I think we should just know that one is going to be extremely difficult to come back from. Yeah, and I don't know that I'm not sure you could ever come back from the death of a child, but nevertheless, I mean, it's I'm trying to sort of give you some of examples to see the difference in what, to have some sort of standard of measurement so that you can have a way of self-examination. So at the tipping point, if functionality starts to go, and that's when you need an intervention then anyway, because now what's happening is not only are you unhappy, but you're going to lose the ability to be productive